I'm Dr. Joe Esposito, and welcome to our podcast, For the Health of It. Remember to subscribe to our podcasts, and I'll help you naturally get well and stay well.
The information presented on this program is not intended to take the place of your personal physician's advice, and it is not intended to diagnose, treat, cure, or prevent any disease. Discuss this information with your own physician or healthcare provider to determine what is right for you.
Are you suffering needlessly? Dr. Joe can give you advice on how to naturally get well and stay well. Dr. Joe Esposito.
What we're doing today is we're answering a lot of the questions that come in on our website. Now, we get a ton of questions on our website, drjoe.com, people wanting to know what to do with certain issues. And many times I have an answer. Sometimes I have to say, listen, you need a neurologist, you need a cardiologist. It's something that is not within our scope of practice or our wheelhouse. But usually I can give you some advice to deal with the issues as well as getting an evaluation, if necessary. Most cases, we don't need outside evaluations. Most of the patients that come in our office, we are able to deal with in-house, which is great. So we try to get the best results we can for you for the least amount of money in the fastest amount of time with the least amount of side effects. And that's why we always say that chiropractic is the most effective, least expensive treatment for back pain in most cases. Not everyone, but most cases. We can't fix everyone. But a major majority of our patients complain to us after a few weeks of treatment, and they say, why didn't I do this sooner? Why did I wait so long? And I don't know that answer. I don't know why people wait at all. If I have a health issue, I go right away. A while ago, I remember I was seeing flashes out of my eyes, and it was on a Saturday. And I called my eye doctor, and she came in on the weekend and checked me out. And she goes, nope, you're fine. I said, good. I wanted to find out right away. I didn't want to wait till Monday. I paid a little extra because it was an emergency visit, but it was worth it to me. Because when it comes to health, the faster we get to the problem, usually the better results we can get. So let's go into a bunch of questions that you guys have sent me and some other things that pop up. If you sweat a lot, constantly, all over your body, not just your armpits, not just your hands, but everywhere, and you feel very anxious, you probably want to get checked out by a cardiologist. Because this can be a sign that the heart is not working properly. And if the heart's not working properly, the body sends up these sympathetic reactions, these fight or flight messages. Hey, something's wrong. Fix me. That anxiety, that feeling of impending doom, pressure on your chest, sweating a lot. These could be heart issues, and you want to get that checked by a cardiologist, or certainly at least a medical professional, as quickly as possible. Don't play around with that because it may be too late if you wait too long. Other things, your eyes turn yellow. I had a patient a couple of months ago come in. Their eyes were yellow, and it wasn't real bright. It was yellow. It can be called jaundice, and sometimes the skin actually starts to turn yellow as well, and it means the liver isn't properly breaking down something called bilirubin, and that's a pigment that can cause yellow coloring in your skin. You might want to get your liver tested right away. It's not something you want to jerk around with, especially if you have a family history of liver problems and or you have a bad diet and or you drink a lot of alcohol. Don't wait, get it checked. The good news about liver conditions, it's the fastest healing organ in the body. So in many cases, we get to the liver, we get you on a good plan to stop putting the junk in there, the alcohol, meat, sugar, dairy, coffee, soda, artificial sweetener, breads, cookies, cakes, donuts, pastas. Stop that going in. Then we get you on a good supplement protocol. Dr. Joe's Super Greens, Dr. Joe's Essential Source, Dr. Joe's Glutathione. Glutathione, master antioxidant, great for getting the liver to heal. Milk thistle, great for getting the liver to detoxify itself. And then also we make sure the medical doctor's aware of what's going on. And the liver, it so often heals so fast. But the longer you wait, the more damage there is. Scar tissue can form in the liver. Fatty deposits can form in the liver. And it's a lot more challenging. When I went to school a couple hundred years ago, we were taught that if you see fatty liver, it's caused by alcohol. That was it. One question, one answer, done. Now, we see something called non-alcoholic fatty liver. Non-alcoholic fatty liver can be caused by too much sugar, specifically fructose. And where do you see fructose? How about something called high fructose corn syrup? It's everywhere. And it's in so many different products and junk foods and sweeteners and breads and candies. And fructose, when it gets into the liver, has to be converted into something called glucose. Glucose is the sugar that your body uses as a fuel. So fructose converts into glucose in the liver. In the process, it gives off a waste product called uric acid. Uric acid can get in your joints and it can hurt. So I see a lot of patients, of course, as a pain clinic and a wellness clinic. We see a lot of pain patients, and we do a dietary workup on every one of them. And then we sit down with the patient. We say, these are our recommendations. Now, whether you do them or not is totally up to you. We can't make you change your diet. We can't make you take supplements. We can't make you get chiropractic care. But why wouldn't you? That's why you're here. And if we can get people to get the spine and all the joints in the body lined up the best we can, if we can get them on a good diet, if we can get them off the bad foods and eat the good foods, if we can get them to start, if they have acid reflux, start seeing us so we can pull the stomach down away from the diaphragm. And by the way, you can't do that yourself. If there was a way to do it yourself, I would have figured it out years ago. You cannot get the angle. You don't understand the anatomy, the physiology, the vectors, the physics that goes into pulling the stomach down away from the diaphragm. So I wouldn't recommend you try it because you might hurt yourself. So come see us, let the professionals do it, and let's get the stomach fixed. Let's get the diet fixed. Let's get the nervous system working. And in most cases, whatever your health condition is, you're happy with the results. If you'd like to make an appointment, you can go to our website, drjoe.com. In the Atlanta area, we have offices in Marietta, Duluth, Stockbridge, and West Cobb. We would love to be your doctor. We accept almost every insurance. I think one or two we don't accept. And the only reason we don't accept it is because they don't pay enough to make it worth our while. Some insurance companies, you wonder why doctors don't accept insurance. Let me go off on a tangent here. The insurance companies make it so impossible to fill out the paperwork and follow their guidelines, and you got to do what they say. You can't, no, this person doesn't need that. They need what I think you need. No, the insurance company says, got to do what they say. So in many cases, doctors don't accept insurance because it's just not worth it for them. Now, we have cash plans available that are pretty much going to match most insurances because your copays are ridiculous, as you know. It used to be a big issue. Nobody even talks about it anymore. Copays, deductibles, crazy. So if you want to be a patient, and again, about 50% of our patients are cash patients, you can go to our website, drjoe.com. You can book an appointment right online, or you can call us. We're more than happy to get that set up for you. Again, offices in Marietta, Duluth, Stockbridge, and West Cobb, the Atlanta area. So we're talking today about questions that people send me and symptoms and signs that could mean something more. If you urinate a lot, it could be a sign that you might have diabetes. Now, if you drink a lot of water and you urinate a lot, different story. But if you can't make it through a movie, you can't make it through dinner, you got to wake up a lot at night, and you're not drinking that much water, it could be a sign that you might have a diabetes issue. And it's called polyuria, poly meaning many, urea meaning urine, so a lot of urine. And in fact, the word diabetes comes from the Greek words for siphon, to siphon fluid out. So when a person has diabetes, they have high levels of sugar in their blood. The kidneys filter the blood. The sugar gets into the urine. And because of osmosis, the sugar, which is a salt, but anything that dissolves in water can be a salt, it pulls fluid in because it's a salt. It pulls it by osmosis. And then you effectively create this large amount of urine. And that's a big issue. So again, a lot of urination, and maybe you have a family history of diabetes. Maybe you have a bad diet. Gee, surprisingly. If you listen to the show we did on diabetes, if you go to our website, drjoe.com, and just type in the word diabetes in the search bar, listen to the show we did. We covered a lot of health tips on diabetes. And here's the thing with type 2 diabetes. In most cases, you can reduce or eliminate the need for medication for type 2 diabetics strictly by changing your diet. And once again, we talked about this earlier, the disconnect between science and healthcare. The science is there. Proper diet, high fiber, certain supplements can reduce or eliminate the need for most type 2 diabetics medications. And yet, I've never had a patient come in my office that's diabetic and say, my diabetes doctor told me to eat better, change my diet, plant-based, certain supplements. Never heard it before. Gymnema is a supplement we use for diabetics, helps stabilize the blood sugar. There's many others. And I'm just amazed that the science and healthcare there's such a disconnect there. And diabetes is a perfect example there. But listen to the show we did on diabetes. Do what your doctor says. Always do what your medical doctor tells you. Add this. Add the nutrition, add the chiropractic, add the supplements, add the stomach manipulations to your protocol. And let's see if we can get you well enough so you don't need the medication. You might never get well enough to not need the medication. But what if we could? Wouldn't that be cool? And in a lot of cases it is, because patients come to us all the time. We see it. Doc, I did everything you said. I went back to my whatever, cardiologist, endocrinologist, whatever it is. And he said, my blood work is looking better. We're going to reduce that medication. Blood pressure. We're going to reduce the medication. Or we're going to eliminate the medication. And inevitably, the doctor says, well, what are you doing? Well, Dr. Joe Esposito told me to do this, this, and this. And the doctors inevitably say, keep doing it. Nobody argues with it. I've never had a doctor argue with me. Because I'm not saying stop your treatment with them. I'm saying let's add this to it. Doctors say, whatever you're doing, keep doing it. It's working. I've had patients for every cancer, kidneys, stomach issues, liver issues. And not everybody gets well. But in most cases, we get great results. If you wake up with a headache, could be several things. Number one, and the most common, is that you have a pinched nerve in your neck. I know I have severe damage to my neck. I got hit by a car, played football, hockey, street fights, had a stupid childhood, and I damaged my neck pretty bad. If I sleep, if I wake up with my head turned to the right, chances are I'm going to have a headache. I got to come into the office, get my doctors to adjust me, and try to calm down that headache. So if you wake up with headaches, many times it's the bones out of place pinching nerves. And so chiropractic care becomes the most effective, least expensive treatment in most cases for headache cases. So why wouldn't you do that? You might want to come see us. Now, you could also have sleep apnea because you're not breathing properly, and that can cut off the oxygen to your brain, and that can cause an issue too. Now, sleep apnea is usually caused by the stomach pushing up against the diaphragm. When the stomach pushes up against the diaphragm can't drop down, so you can't get oxygen, and you have that snoring. You know people like that? Usually caused by the stomach up against the diaphragm. Pull the stomach away from the diaphragm. We also check the fourth cervical vertebrae, because the fourth cervical vertebrae, that's where the nerve comes out of the spine called the phrenic nerve. The phrenic nerve controls the diaphragm, which goes up and down and sucks air in and out of your body. So if you have a pinched nerve in your neck, it could be causing headaches, but it could also be affecting the phrenic nerve, which can affect the diaphragm, which can affect your breathing, which can cause sleep apnea, which can cut off the oxygen, which can cause headaches when you wake up in the morning. So in our offices, we always do, every case we do, like I just said, let's go down a rabbit hole. Let's try to find out where the problem is coming from and get to the cause of the problem and not just treat the symptom. It's a very different approach in healthcare. I don't know anybody else that's doing that. And that's why we get patients literally from all over the world come to see us. We have doctors and hospitals and insurance companies and judges send us patients. Take a look at this and let's see what we can do. And in most cases, great results. Not all, but most. If you start to lose your eyebrows, it could be a thyroid issue. Talked about thyroid earlier. Eyebrows tend to be thin as we age, but hypothyroidism, that's when the thyroid gland stops putting out as much thyroid hormones, can cause eyebrows to fall out. Usually the outer third of the eyebrows are affected most. Now the good news is once you start treating it, the eyebrows grow back. Now, if you have a thyroid condition, or you think you might, go to our website, drjoe.com, and type in the word thyroid in the search engine. Listen to the show we did on thyroid. We covered a lot of topics in that thyroid show that we did, and maybe you'll pick up some pointers that you could utilize as well. And that's what's so cool about the website. We've got thousands, at least 2,000 hours of podcasts, audio and video. Some people are visual learners. You try to listen to something, you drift away. With audio, you can pay attention. That's with video, I'm sorry. So we have the video of a lot of the lectures that we've done. You can watch the videos. Listen to the audio when you're working out, while you're doing gardening, while you're driving. A lot of good information on that website, and the cost for all that information, absolutely free. I can't make it any easier for you folks. I'm not going to come to your house. That's the only way I think I can make it easier for you. But if you have health issues, go to our website, drjoe.com, type in what you're looking for, listen to the podcast, send us your questions through the website. If you want to make an appointment to come see us, we'd love to have you as a patient. drjoe.com. It's all over the website, folks. It's right on top. Want to make an appointment, ready for a consultation, book an appointment. It's usually at the top and the bottom of the page and usually in the middle of the page as well. Click on it, brings you to a calendar, send in the dates you think are good. My staff will call you, let you know if those dates work, give you all the information you need. Can't make it any easier for you, folks. And everything that happens in first visit and second half of the second visit the total value is about $720. We're going to reduce it down to $299 for you. And we take almost all insurances. So there's no reason why you should be suffering any more than you are. Go to the website, book an appointment for you, your friends, your family, and your children. If children start out healthy, chances are they're going to grow healthy. If they're crooked, they're probably going to grow crooked. So bring your kids in as well. They need care too. They have spines just like you. How young can I adjust a patient? I've adjusted, the youngest patient I ever adjusted was fresh out of the womb. So probably about 3-4 minutes old. The oldest I ever adjusted was well into their hundreds. So we can adjust you from cradle to grave, folks. And hopefully that's going to extend that time a lot longer too. If your hands, we talked about this earlier, if your hands get cold and if they're pale, that can be pinched nerves in the neck, could be anemia. Now, if you're taking things like acid reflux medication, the acid reflux medication lowers your stomach acid. You need stomach acid to absorb certain nutrients like calcium, B12, iron, and magnesium. Many times when patients are on acid reflux medications, they're low in calcium, B12, iron, and magnesium. And so you need to do an extra level of treatment to get the patient well. A, we try to pull the stomach away from the diaphragm, so hopefully they don't need that medication. And then B, we'll do a nutrition workup on them and make sure they're getting the proper nutrients. Now, you need stomach acid. Stomach acid breaks down proteins. Takes proteins, unravels them, it looks like a ball of yarn, chops it up into something called amino acids. The amino acid tryptophan becomes serotonin in your brain. Serotonin makes you happy. Serotonin becomes melatonin, helps you sleep. Tyrosine becomes dopamine. Dopamine gives you pleasure. Glutamine becomes GABA, suppresses pain. So your digestive system is so key when it comes to you being healthy. And if you're not breaking down your acid, your stomach acid isn't breaking down proteins properly, it can lead to a myriad of other health issues. And in many cases, again, here's the disconnect between science and treatment. We try to treat each individual symptom. You have low serotonin, we give you medication. You have low melatonin, we give you medication. You have low dopamine, we give you medication. What if we found out why you have these low levels of neurotransmitters, and let's go ahead and fix it? And that's the approach we take in our office. We try to get to the cause of your healthcare problem and not just treat the symptoms. And most of our patients really like that approach. So if you'd like to be a patient, drjoe.com, book an appointment right now. Other things you might see as symptoms. If your cuticles, part of your fingernails there, are bright red, they should be like half moon and kind of white colored, it could be a sign of an autoimmune disease, like lupus. So if you have an autoimmune disease or think you do, go to our website, drjoe.com, type in the word autoimmune, listen to the shows we've done on autoimmunity, and we talk about how to stabilize the immune system. We don't want to stimulate or suppress, stabilize. Vitamin D, so important for the immune system. Glutathione, important for the immune system. Probiotics, important for the immune system. I take all those every single day. You should too. So again, if you have these signs, it could be something that there's something wrong. If you have a lump in your breast, men and women, especially under the armpit, it could be cancer. You want to get that checked out, not by us, by a cancer specialist. Now, might be nothing. Could be just a swollen lymph node, which in most cases it usually is. But if it is there, you want to get that checked out as quickly as possible. I personally send out cancer patients to Cancer Treatment Centers of America. I have no affiliation with them. I get no payment from them, no kickback, nothing. I just love their approach. Their approach is they try to use holistic approach as well as medical approach. They take the best of all worlds, which is what we try to do in our offices as well, to try to get to the patient the best results. And they have amazing success rates. So that's where I try to send my patients. Cancer Treatment Centers of America. Again, I have no affiliation with them whatsoever. I just like the work they do. Now, if your fingernails have white spots in them, it could be that you're low in zinc. Now, zinc is really important for the immune system. So if you have white spots, it could be a zinc deficiency. We can do tests, by the way, in our offices. We can do a micronutrient test to determine if you have certain nutrient deficiencies. We can do allergy testing if you have food allergies. But zinc is pretty common to be deficient in. You can get it from like red meat and poultry, but I don't recommend you eat red meat and poultry. But you can also get it from beans, lentils, legumes, things like this. Seeds, wild rice can also get your zinc levels up. If you have a scratchy throat, if you have something coming on, so to speak, I always keep around my house zinc lozenges. Because when you suck on the lozenge, the zinc goes down into the throat and can bind to the virus. When it binds to the virus, it prevents the virus from then replicating. Taking zinc as a supplement can be good, but the lozenges seem to work better because it actually comes in contact with the virus. So scratchy throat, zinc lozenges all day, every day. I think they're great. Try to get the ones that don't have a lot of sugar in them or a lot of dyes. Some companies have these bright red ones and they're real pretty. You don't need that. Simple tablet, suck on it, get the zinc down into the throat. Really, really important. But again, spots could be on your nails, could be a sign of zinc deficiency. We talked about cold hands and also B12. Vegetarians or vegans are at risk of that. That's why Super Greens, Essential Source, and a B complex I take every day. You probably should too. Most B vitamins, if you take too much of them, you're going to pee them out anyway, which is great. If your heels are cracked, anybody have that problem? Heels get all cracked and ugly? Check your thyroid. If you have that condition, you can sand them down and you can put lotions on them. That's all well and good, but it could be a thyroid condition, so it wouldn't hurt to get that checked. If your ankles are swollen, could be a sign of high blood pressure. Now, there's two types of swelling that we can see in the ankle. One is called pitting edema. Pitting edema is this. You've played with Play-Doh when you were a kid. If you push on the pitting edema and it stays there, like Play-Doh, that's a sign, it could be a sign of congestive heart failure. So when I see patients like that, I like to get a cardiology workup on them. If you push on it, bounces back, it could just be pinched nerves in the low back. The nerves in the low back control the blood vessels in your feet. And so many times we adjust that low back area, open up the nerve and blood supply into the foot, solves the problem. Could be high blood pressure as well. Get the blood pressure under control, and that works. If you have high blood pressure, go to our website, drjoe.com, and type in the words blood pressure in the search bar. Listen to the show we did on blood pressure. Blood pressure could be a sign that there's a digestive issue, because the nerves that control the digestive system is called the enteric nervous system. That's controlled by the vagus nerve, and the vagus nerve also controls your heart. So in many cases, I see somebody has high blood pressure, it's a digestive issue. We got to fix the vagus nerve. They may not be drinking enough water. Chiropractic care, adjusting the atlas, the top bone in the neck, many times has shown progress for helping people with blood pressure. So we always try to get to the cause of the problem and not just treat the symptoms. Now, if you have to treat the symptoms, absolutely do it. But getting to the cause, along with treating the symptoms, is the approach we like to take in our offices with our patients. If your stool is black, that could be a sign of a stomach ulcer. It could be bleeding. It's called occult blood, and it could be bleeding in the upper part of your digestive system. If it's red blood, it's called frank blood, or red blood, that can be that you could have hemorrhoids. You may be cleaning your bottom too aggressively. I'm a big fan of bidets. Bidets are very popular in Europe. Now you can buy them for about $30, hook it onto your own toilet yourself. It takes about 15 minutes to do. Much more gentle on taking care of your hygiene and much more effective too. If there's too much red blood, it could be that, like I said, hemorrhoids, it could be you're too aggressive. Hey folks, I just realized I'm almost out of time. I got so much more I need to cover. If you have any healthcare questions, send them to me through the website, drjoe.com, drjoe.com. If you'd like to make an appointment to come see us, we have offices in Marietta, Duluth, Stockbridge, and West Cobb, Atlanta area. We would love to be your doctor. We are very good at treating car accidents. I even taught a whole seminar for a bunch of doctors, physical therapists, attorneys on how to deal with car accident cases. So car accidents are a different animal. Not every doctor knows how to deal with the case of car accidents. We're really good at it. So if you have a health issue, neck pain, back pain, shoulder pain, headaches, numbness, tingling, sciatic pain, car accidents, make the appointment right now. Dr. Joe, drjoe.com. You can book it right online. You can call us. We'll get you set up as quickly as possible. Stop suffering needlessly. I'm Dr. Joe Esposito again, drjoe.com. Thanks for listening to For the Health of It. Remember to subscribe to this podcast, and I'll help you naturally get well and stay well. You can also listen to and call into my radio show live Sunday evenings from 7 to 9 Eastern Time on WSBRadio.com and on a WSB Radio app.